Hello, Dr. Suhel. Welcome to the Health Trips interview series. Could you please introduce yourself for the benefit of our viewers?
Thanks for having me on your series. I'm Dr. Suhel here at Narayana Hrudayalaya Hospital. I'm an ENT surgeon here at our facility. I've been here for over 2 years practicing in the Narayana Hrudayalaya Health City.
Thank you, Doctor. So, I wanted to talk to you about cochlear implants. What are cochlear implants and when are these implants used?
Cochlear implants are actually devices used to improve the hearing of a child in most cases. These are used for children who are severely or profoundly deaf from birth and who are usually not able to benefit with a hearing aid. These children are the right candidates for cochlear implantation.
Okay, so is there an ideal, a candidate, or is
the rule is the earlier the child is implanted, the better. Say upwards of 1 to 1.5 to 2 years, because the earlier we implant a child, the earlier the child hears sounds and the earlier they can develop speech. Children or who are much older, the results, they can be implanted, but the results are not as good.
Sure. So, how long does such a surgery take, and how long does a patient need to remain in the hospital?
The surgical part itself takes about 3 hours, and the child or the person would need to be in the hospital for about 4 days in the recovery period.
Sure.
But a lot of other planning needs to be done before the child is considered a good candidate. Some investigations,
Okay.
scans, and we need to know whether the child will really benefit from cochlear implant. So there is a certain amount of workup needed before the children could be considered as candidates for the implant. And there is obviously, which I will go on and tell you, that after the implantation is done, the surgical part, it is very essential to have the child or the family with close access to a therapist who is involved in the education and the speech and audio-verbal education of this child. So they need to be at close quarters wherever the therapist is there.
So what does it mean for patients for say coming in from the Middle East and Africa for treatment? So what does it mean for them?
We do get a lot of people inquiring about the surgery and wanting to know what the whole process is. The implantation, like I said, is a surgical procedure that can be done anywhere or if done here. But the child needs to get the therapy in the language he or she speaks in their homeland, whether it's from the Middle East. If they're Arabic speaking, probably this therapy would need to be in Arabic. And then they need to be also secondly at close quarters to this place, because after the implantation is done, they need to pay regular visits to this therapist for at least a couple of years, not just a few days.
Sure.
So it's very important that we make this and inform the patients that after the surgery they need to have access to somebody who would be there to rehabilitate this child.
Okay, thank you, doctor. So what are some of the complications that could arise during such a surgery?
See, during the surgery, like any surgical procedure, there are complications. Immediately post-op, and this is a very technical operation where electrodes are passed into the inner ear and through I don't want to get technical, but through a window in the ear which goes along the cochlea, and each surgery is on its own, how well the electrodes pass in, to what extent they pass in, how well it is situated. These are not complications, but they are slight differences which we could expect with each surgery. Otherwise it is a fairly safe surgery, there is no risk to the child. But yes, we need to watch these child for about 4-5 days post-operatively, because we are entering the inner ear. There is a very small risk of infection, which is taken care of by covering the child with antibiotics, and we would see that the child is discharged only when he or she is doing well.
Okay, thank you. Any last bit of advice for patients or parents considering cochlear implants?
Cochlear implants are now considered worldwide to be actually the specific kind of treatment for children with severe or profound hearing losses, and also certain cases in adults where they have lost their hearing during the course of life due to a specific problem. The children, like I said, the earlier they are implanted, the better, because it does make a huge difference to the quality of the life of the child or the individual if they are hearing and they are speaking. And like we know in societies, a deaf and dumb child, what are the problems for the person themselves, the family taking care, the general society as a whole. So these children or adults could be rehabilitated with an implant and be able to hear, it makes a significant difference in their quality of life.
Thank you very much for speaking with us today, Doctor.
Thanks.